So today I'm going to talk about something a little bit different. Usually what we talk about is, custom paint or custom parts. Most of you that ride motorcycles know at least one person, if not more, that's been critically injured, if not killed in a motorcycle accident. A majority of these motorcycle accident deaths, especially when it's with groups or clubs or friends, could have been prevented if at least one person had the knowledge and the tools and the skill set to address and to stabilize the person until emergency medical services get there. Those first 20, 30 minutes before EMS can arrive are critical. We're going to go over the algorithm right here, which is March. M is massive bleeding. I'm talking massive arterial bleeding, not road rash, not scrapes. I'm talking about massive bleeding, loss of limbs. We're going to make sure the airway, the trachea, the esophagus, that there's no obstructions there in the airway. Then we're going to go on to the respiratory system. This is the lungs, making sure that there's no open pneumothorax, closed pneumothorax, or tension pneumothorax to make sure that we can mitigate problems within the respiratory system. Next is going to be circulation, checking the pulse, making sure it's not a rapid pulse or a super low pulse. The pulse can tell you a lot about what state the body's in. And then we're going to go into H, which is hypothermia and head trauma. So now that we've gone over March, let's go into the tools that I keep on me to address each one of these. So this is my little go bag, my little everyday carry bag, and I do not carry a bunch of shit in this. I only carry what I may need for what I may encounter. First thing you're going to need is you're definitely going to need some medical shears, high-grade medical shears. Do not get these on Amazon. Don't get Chinese brand, get high-grade medical shears. These are phenomenal for cutting seatbelts, for cutting leather, for cutting denim, for cutting boots, whatever you need to cut to get off the person in order to inspect properly any injuries and to treat injuries. You need a good pair of medical shears. These always live right on the side. Even on my kit, they live right down where I can just rip them and go. Now, when we get into the March algorithm, what do I use for M, which is massive bleeding? So I keep numerous tourniquets on me, okay? And the key with tourniquets isn't just having them, but is knowing how to use them and then having them in a location where they can be rapidly deployed. So the tourniquet is used for loss of limb or massive arterial bleeding. You're going to slide up onto the highest part of the limb. You're going to pull the strap all the way around as tight as you can, and then you're going to crank it and then lock the crank within that little coupler, right? There's a lot of trauma going on, or sirens, or it's really loud and crazy and chaotic, and there's blood and there's people losing limbs and all this other shit. Your body and your mind is going to go into autopilot mode. Your critical thinking is going to be severely limited because of the endorphins, because of the adrenaline, all of the sensory overload that's going on around you. So to have all of your medical equipment where you need for a rapid deployment and exactly where it was in training is imperative, because then your body just knows what to do. I'm going to open it up. It's already ready to go. I'm going to undo the sleeve, put it on. You're not fumbling around with this being closed and trying to, do all this. Keep this off to the side. Keep this folded in a manner where you can just rapidly deploy it. I promise you, it's critical. So for wounds that may not call for a tourniquet, I keep hemostatic gauze. This is combat gauze, which is basically gauze with quick clot in it. So for the critical areas where you cannot use a tourniquet, which is the junctions, your neck, shoulders, armpit, groin, buttocks, these are the areas that you're going to want to have hemostatic gauze for those arterial bleeding. You're going to make a power ball, push it in as far as you can, and pack that wound until the bleeding stops. You're going to pack it and pressure. I keep an Israeli bandage. A lot of people don't like these. I like them. You can put this over the wound that you have just done hemostatic gauze in, or maybe you don't need hemostatic gauze. It's just you need to keep pressure on a wound. You're going to put this over the top. And now you can see that it has a little wing here. So when you bring this up, you're going to tie this into the wing. And what you can do is now, just like a tourniquet, you can tighten this down to keep massive pressure. A lot of people don't like these. I like them. I think that they work wonders for keeping heavy amounts of pressure on a large wound. So whether you're using it in conjunction with hemostatic gauze or you're just using it by itself, this is an invaluable tool. Going from M, we're going to go to A, which is the airway. Now for the airway, I carry nasal pharyngeal tubes and oral pharyngeal tubes. I'm not going to go too much into those because it's a little bit more advanced on how to employ those and how to use them and what to look for. But in short, if there's obstructions in the airway and they're semi-unconscious and they've had a really bad rear head trauma, now they've fractured their skull, it's pressing up against, you're going to use a nasal pharyngeal tube to open up that airway in order for them to breathe. Let's say they're completely unconscious, it's better to use an oral pharyngeal tube. It's just it's mission dependent. So those are what I keep to open up the airways. If you can find plenty of videos of those on YouTube if you want to learn more about nasal and oral pharyngeal tubes. I'm not going to get into it. Talking about the respiratory system, I like to think of it as your entire trunk in a 360 degrees, right? Make sure there's no punctures, make sure there's no wounds. If there is any puncture to the trunk, which is anywhere in the chest, in the sides, underneath the armpits, in the back, what have you, if there's any punctures, what we're going to do is we're going to use a vented chest seal. You can see these little rivers right here. This is for drainage. So when you put this over the wound, it seals the wound in order to make sure that we can continue breathing and everything's normal, but it also has these rivers so that way blood or whatever else can drain out. The old style that don't have these rivers, you'd have to burp it which is basically pulling it off to release the pressure, release the blood, whatever, and then put it back on. But you want to get vented chest seals because these are great for natural drainage of the wound. Now, something else that's super important that I keep on me is I keep catheters and needles. And this is for needle decompression therapy. This is for if we have open or closed or tension pneumothorax. So basically your lungs are encapsulated in another membrane called pleuromembrane. Pleuromembrane helps lubricate the lungs to glide up and down a thoracic cage or your rib cage. So what happens is, like, let's say your buddy goes down, he breaks a rib, it punctures his lung. What's going to happen now, once that lung is punctured, that air is going to be escaping that lung into the pleuromembrane. It's going to create like a balloon. That balloon is going to create pressure against the rib cage and the lungs, which will collapse the lungs. So you have to alleviate that pressure, and that's what the needles and the catheters are for. The things you want to look for is if there's a severe progressive respiratory distress, severe or progressive tachypnea, a limited breath sounds on one side or the other. And then if you have the capabilities, you're going to be looking for a hemoglobin oxygen saturation of less than 90% on their pulse oximetry. So there's two different spots that you can put into. You have up here, you can feel your ribs or the second ICS. If that location is, compromised underneath your armpit. Every penetration hole within the trunk, 360 degrees, we're going to put one of these, if not 4 or 5, it doesn't matter. It's not going to hurt. If you put it on there and it's not supposed to go there, who gives a fuck? But it's better to have it and not need it than need it and not have it. We're going to jump right into hypothermia and head trauma. Hypothermia doesn't have to be 150 degrees outside to go into hypothermia. Hypothermia will set in when there's massive blood loss. It'll create more blood loss. It'll create shock in the body. All of this will happen under hypothermia. So no matter what, if it's a serious situation where your buddy goes down, he lost a leg, keep them warm. Blankets, shirts, jackets, whatever you have, keep them warm. Don't move a motorcycle accident unless you absolutely have to for their safety. The best practice is to keep them right where they're at. Don't try to take their helmet off. The helmet is actually great for stabilizing the neck and the spine. And, if there is a traumatic spinal injury and you move them and it breaks more, they could be paralyzed, they could be dead. So just leave them where they're at unless it's absolutely necessary to move them. If it is necessary to move them, make sure you have more than one person so they can make sure that they're grabbing from the shoulders and the neck and the head to keep that in place and slowly move them over, cover them with blankets. And again, do not take it off. They broke their arm or they broke their neck. The splint is actually great for that. I've actually used this for that situation. This is malleable, so you can put it around. So the splint works wonders for stabilizing the neck, stabilizing the head, and what have you. That's pretty much it. That's all I carry. It's limited items, but that's all I need for traumatic injuries that I may encounter on motorcycles, riding with my friends, riding in the truck, whatever it may be. Again, I'm not a doctor. I'm not a paramedic. Your best bet is to get with somebody who's an actual medical professional to get some proper training. So what I'm going to do is I'm going to post up this pack on the website, and it's going to be filled with curated individual medical supplies that I carry, and you can order it instead of having to order a gigantic IFAC. This will have all the stuff that I carry that you'll use for day-to-day things. And then if there's something else you want to add to it, you can always order that in the future. So thanks for watching. See you next time.